Okay. Good luck, guys.
Thank you.
Let me know if you need anything.
And ice cream? You already ordered those? Oh, that's good. Okay. Yeah. Don't come for the food, come for the ice cream. Yeah, you might as well. So hot. Today I don't.
Really nasty. We got our food.
Today I don't have
So I'll be here on Monday and Tuesday. I've got run all day, until about 3 or 4 anyway. And then I'm going to try to pay attention to my email on the weekend. So if you have some questions, I'm sure you'll be studying over the weekend for this. So anyway, this is the last lecture in this series. Talk about the autonomic nervous system. This is really, when I got my PhD's in pharmacology. I got at the University of Illinois in Chicago. They have a really old, wise pharmacology program. And a lot of pharmacology, of course, was discovered using the autonomic nervous system. We used to have a dog lab that we did for the medical students where we injected all kinds of stuff into these dogs. Can't do that anymore, but this is a long time ago, 40 years ago when I was doing this. So anyway, the autonomic nervous system is really an amazing thing. Of course, there's two, this is the objectives again, so this will give you some guidance about what to focus on there. So anyway, in the autonomic nervous system, there's always two neurons. So the ascending pathways, sensory pathways, there's just one neuron. And the motor pathways, there's, from the spinal cord out, there's just one neuron, the motor neuron. But these sympathetic and parasympathetic motor pathways, there's always two neurons in the pathway. So you have one that's in the CNS, and it's in the spinal cord. These can be in the spinal cord or in the brain stem, whether you're talking about head and neck or trunk and limbs. So there's one the preganglionic neuron in the CNS, and then there's some kind of a ganglion for the sympathetic nervous system and the parasympathetic nervous system that has the second neuron cell body in it, and then the second neuron projects to the target. For both of them, the preganglionic neuron releases acetylcholine, and the postganglionic neuron has nicotinic cholinergic receptors on it to pick up the signal in the ganglion. And then the sympathetic nervous system, of course, releases mostly norepinephrine onto its target. And there's a lot of adrenergic receptors here. And then the parasympathetic nervous system releases acetylcholine onto its target. And then the receptors here are muscarinic receptor subtypes. Now Now in the trunk and limbs, there's this pattern where well, there's several ways to separate them out. One is the what's released here at the target. Another one is the length of the preganglionic and postganglionic limbs. So in trunk and limbs with the sympathetic nervous system, this postganglionic limb is usually pretty long. So this ganglion, the collateral ganglion, there's a whole bunch of them that are. We have the chain ganglia that go up and down the spinal column. And then you have another set of collateral ganglion that run up and down the aorta. So you have one right next to the celiac ganglion, celiac trunk, which is the first unpaired artery that comes off the aorta. And then you have one on the superior mesenteric and one on the inferior mesenteric, and there's some renal collateral ganglion and various other ones. And they're usually a long ways away from the target, so this postganglionic axon is pretty long. On the other hand, with the parasympathetic nervous system, the postganglionic cell body is usually in the wall of the target organ. So it's like the gut or the liver or something like that, the heart. The terminal ganglia is in the wall of the organ, or very close to it. There's, of course, exceptions to this, but it's just a general trend. Now, in head and neck, it's different. Okay, there's just, in the first place, there's just parasympathetic system in cranial nerves. The sympathetic fibers just get to the head by running up blood vessels. In the head, this postganglionic axon is fairly long, just like the sympathetic system in the trunk and limbs. Another big difference between them is where these cell bodies are. So for the sympathetic nervous system, they run from about T1 through L2 in the spinal cord. And in the sympathetic nervous system, it's cranial sacral. So the cell bodies are in the brain stem or they're in the sacral spinal cord. And then another thing that separates them out, of course, is function. The sympathetic nervous system tends to gear you up for action, fight or flight, whereas the parasympathetic nervous system can be termed rest and digest. It just you're more in a passive situation, and this is functioning more. And I'll get into more of these functions as we go along. But there's anatomic and neurotransmitter and other differences between these systems that separate them out, as well as the function. This just summarizes it, the differences between the two things as far as neurotransmitters and receptors. I added this in here. This is not in your PowerPoint. I didn't want to post it at the last minute because I know a lot of people have already downloaded the thing, so you might want to write that in. So for the sympathetic system, preganglionic is acetylcholine, and postganglionic is norepinephrine. This is on the target here. And receptors, the postganglionic target on the postganglionic cell body is the nicotinic cholinergic receptor, and the target it's beta 1 through 3 or alpha 1 and 2 receptors. And there's one exception though, the innervation of the sympathetic nervous system of erector pili, that should be an A-R-R. That's spelled wrong. Erector pili and sweat glands. The sympathetic nervous system actually secretes acetylcholine onto those targets. And it's a muscarinic receptor that's involved in that one exception. For the parasympathetic, it's preganglionic acetylcholine, postganglionic is also acetylcholine, and then the receptors, postganglionic, it's nicotinic, which is the same as up here, and then the target is muscarinic receptors. So this just goes over the major functions. Sympathetic is fight or flight, maximize use of body resources. So, it's as if you're, a Rottweiler's charging out of the garage as you're walking along and you got to get away. A lot of things happen. You want to be able to see the Rottweiler, okay? So your pupils dilate. You want to be able to get all the blood you can to the skeletal muscles so you can run as fast as you can and get away from that Rottweiler. So you get constriction of blood vessels to areas that aren't involved in getting away or fighting, like gut, skin, and then there's a dilation of vessels to the skeletal muscle, liver, because liver has glycogen, right? It stores glycogen. You want to be able to get that energy out of the liver. Heart, lungs. So that blood flow to those areas is increased. Increased cardiac output. Dilate your bronchi so you can breathe. It also makes the mucus in the secretions into the lungs thicker, so you don't tend to aspirate when you're breathing heavily. Increases glucagon release by, that should be liver. Pancreas doesn't release glucagon. Well, maybe it does. The pancreas releases that. That's a hormone, and then increases the conversion of glycogen to glucose by the liver. Okay, sends more energy to the muscles. Then when you get away from the Rottweiler and you're sitting in a tree, you can just rest and digest there for a while. Your pupils will get constricted to protect your eyes from UV. Do a lot of things to conserve energy, constrict the bronchi, reduce cardiac output, and stimulate digestion, saliva production, and other things. So there's quite a in many areas, in several areas, the sympathetic and parasympathetic systems actually oppose each other, especially on the heart. The sympathetic system increases heart rate and force of contraction, whereas the parasympathetic decreases heart rate and force of contraction. But there's other areas where they don't really overlap.
So,
Yeah.
before you continue past that slide, did you say earlier that the cranial nerves, only the parasympathetic nervous system is found in the cranial nerve area?
Exactly.
How does it the eyes constrict then? Is that not a cranial nerve function?
No, the sympathetic, so that comes from the superior cervical ganglia. The postganglionic fibers come from the superior cervical ganglia, and they go up the carotid artery. They follow their way up the carotid artery onto the ophthalmic artery, and then follow that into the eye. So all the sympathetic fibers in the head are postganglionic. There's no sympathetic ganglia in the head. It's all postganglionic fibers winding their way up blood vessels. And they use some nerves too to get different places once they get up in the head. So there's a lot of sympathetic stuff going on in the head, but it just doesn't, none of it's carried in cranial nerves. And none of it originates with cranial nerves. So this shows the sympathetic nervous system, thoracolumbar here. So you've got the spinal cord here, levels T1 through L2, and the sympathetic preganglionic sympathetic cell bodies are in the intermediolateral cell horn of the spinal cord. So you've got a dorsal horn, a ventral horn, and then in between there you've got this intermediolateral cell horn. And that's where these cell bodies are. So you can see it's quite complicated here. Some of the fibers come out and synapse, and these are the chain ganglia that run up and down the spinal column. And of course, they go up higher than the cell bodies and lower than where the cell bodies actually originate. And then you have and there's synapses in there, and postganglionic fibers going out. And then you have these collateral ganglia that sometimes they're called prevertebral ganglia. I like collateral ganglia. I think that's more common. These are all along the aorta. So what I want to do slides to show you some scenarios about how this the anatomy and how this innervation occurs. Here you can see here's the superior cervical ganglia, and you can see here's the postganglionic cell here, and its axon is going out, and then it's going onto the carotid artery and going up into the head. So the parasympathetic, the sympathetic fibers in the head are all postganglionic, and they make their way up into the head by following blood vessels. So this just goes to show, this is some scenarios that you can see with the sympathetic nervous system. So here you have your cell body, preganglionic cell body, and the intermedial lateral horn. And it sends an axon out the ventral root with the rest of the motor fibers that are going to skeletal muscle. And then it runs along the spinal nerve and goes down into the chain ganglia. So they all go through the chain ganglia. And then there's several things that can happen here at this point. This fiber can, one thing that can happen is the fiber, instead of synapsing at the chain ganglia that's right at the level where it left the spinal nerve, it can go up or down a couple of levels. It snaps in another chain ganglia. And don't forget here, the way it gets over here to the chain ganglia is through this, the preganglionic fiber is myelinated. And so it goes along the spinal nerve, and it takes this white ramus that joins the spinal nerve to the chain ganglia and get over there. Okay, and then the postganglionic fibers are unmyelinated, and so they leave via the gray ramus. So anyway, one thing that can happen is the preganglionic fiber comes in and it can go up or down for synapse. Wherever it does synapse, though, one thing that can happen is that the postganglionic fiber could go back up the gray ramus and go out the spinal nerve to a target. So this would be a way that you would get sympathetic innervation to sweat glands and erector pili. They just follow the spinal nerves out to the skin and blood vessels. Also, this would be a way to get sympathetic innervation to blood vessels in the skin and what have you. Okay, another scenario is that the preganglionic fiber can just not synapse here in the chain ganglion at all. It can just leave. Okay, just leave right out of the chain ganglion, forming a splanchnic nerve. So some good examples of splanchnic nerves are the greater, lesser, and least splanchnic nerves. Those are the ones that originate from at the thoracic levels, and then they pass down through the diaphragm and innervate, and then they synapse in the collateral ganglion, like the celiac ganglion, and superior and inferior mesenteric ganglion. Then another scenario is that you can have a synapse here in the chain ganglion, and then the postganglionic fiber can leave, but not go out the spinal nerve. It just forms a special nerve, and this is an example of this are the cardiac nerves. Okay, they just leave right out of the chain ganglion. They don't use spinal nerves to get to their target. They just leave right out the chain ganglion. Any questions on that? Yeah.
Could you repeat scenario 3 again?
Scenario 3 is the 2 and 3 are the same. So that's when the preganglionic fiber leaves the spinal nerve and goes down the white ramus into the chain ganglia that's at the same level as this spinal nerve. Let's say this is T1. But instead of synapsing there in that chain ganglion, it goes down to T2 or up to C8, let's say, before it synapses.
I mean, could you repeat the one with the cardiac?
Oh, the cardiac is, so that the preganglionic fiber comes in and it synapses in the chain ganglion. But the postganglionic fiber, instead of going back up into the spinal nerve through the gray ramus, it just leaves the chain ganglion. It just comes right out of the side of the chain ganglion and goes over to the heart and the lung. That's a good example of that. I'll show you individual examples of it. So this shows innervation of body wall and limbs here. So this is this scenario. So you have your preganglionic cell body here. Axon goes through the white ramus, it synapses in the chain ganglion, and then the postganglionic fiber goes out the dorsal ramus or the ventral ramus of the spinal nerve. And then the target here is sweat glands, erector pili, spelled correctly this time, and blood vessels. Okay. So that's one scenario, just kind of expanded. So that first slide was just showing all of them in one spiel, and I'm not going through each one of them separately. Okay. So this one uses both the white ramus and the gray ramus. This is something we look for in gross anatomy. It's pretty hard to find, but we always tell the students to look for it. Yeah.
So the main difference between numbers 4 and 6 from the last slide is that one's pre-ganglionic axon, the other one's post.
Exactly. Yeah. So the splanchnic nerves are formed from preganglionic fibers. And the reason for that is they're going over to the collateral ganglia that are along the aorta. And I'll show you in just a second. And so they're synapsing there.
Thank you.
Okay, so this is exactly what you're talking about here. So this is the situation where you're forming splanchnic nerves. So here the preganglionic cell body sends its axon out the spinal nerve here. It goes through the white ramus. And then the preganglionic fiber just leaves. So like T1 through T4 all join up, the axons from those levels join up to form the greater splanchnic nerve. No, it's more like T5 through T8 or something like that. And then T9 and 10 are the lesser splanchnic, and the least is T11 or something. So it's more lower down where that occurs. You can see it you can see these nerves when you're dissecting the heart. You get to the posterior abdominal wall. You can see these splanchnic nerves getting formed. So, so this is the splanchnic nerve story here. So some of the splanchnic nerves, the greater, lesser, and least, they go over to synapse and collateral ganglia. So the greater splanchnic nerve, it mostly goes to the celiac ganglia. I'm not going to hold you accountable for that, though. It's just too much information exactly where they go. You'll get that in gross anatomy. But this shows the celiac ganglia right here. Okay, it's right. This is the celiac trunk here, which is a giant trunk that gives off blood to the liver and pancreas and stomach. It's the first major unpaired artery that comes off. It's coming off right here, actually. It's a big trunk right here. And then this is going to the liver, and that's going over to the pancreas and the spleen there. And it's going up to the stomach. That's the celiac ganglia. So, and this is the greater splanchnic nerve. I guess this arrow is kind of in a bad place right here. It should be kind of pushed over a little bit. This would be the greater splanchnic nerve going through the diaphragm. And then the synapses are occurring here in the celiac ganglia. And then the postganglionic fibers just run out blood vessels to get to the targets. Another target for the splanchnic nerve is the adrenal gland. adrenal gland is like it's got a lot of cell bodies in it that release epinephrine and some norepinephrine in the medulla here. So the cell body is like the postganglionic cell, only it doesn't release neurotransmitter directly onto the target. It releases it into the bloodstream, and then that's how it gets to its targets. It's just going through the bloodstream. So your adrenal chromatin cells are the postganglionic cells in the case of the adrenal gland. Oh, this is a little more about the adrenal gland here. So, adrenal gland has a cortex and medulla. It sits right on top of the kidneys here. The medulla is what secretes the epinephrine and norepinephrine, about 80% epinephrine and 20% norepinephrine. Whereas the sympathetic nerve terminals that target things, they release mostly norepinephrine. And epinephrine and norepinephrine have slightly different affinities for the different receptors. So actually the product of stimulation of the adrenal gland has kind of a slightly different pharmacology than norepinephrine released from the nerve terminals. Okay, this shows innervation of thorax. So this is the one where you have the postganglionic fibers coming off. So here you've got, in this case, the preganglionic fiber comes out, uses the white ramus to give to the chain ganglion, and then it ascends up to these higher chain ganglia that are up in the neck here, superior, middle, and inferior cervical ganglia. And then they synapse there, and then the postganglionic fibers, instead of using a spinal nerve to go out to the heart, because there's no spinal nerve going to the heart, so it can't use a spinal nerve going to the heart. So the postganglionic nerve just comes directly off the chain ganglia and goes over to the heart. And there's other ones that go to the lungs and other things in the thorax. Also, there's some sympathetic innervation of the esophagus, mainly blood vessels in the esophagus. They occur by the same mechanism. So this would be thoracic splanchnic too. Well, I guess no, it wouldn't be thoracic splanchnic. They'd just be sympathetic nerves of the esophagus. These are called cardiac nerves here. Then this final situation here is involving the head. Okay, here you have your preganglionic fiber, uses the white ramus to go into the chain ganglia, extends up to the superior cervical ganglia, and the postganglionic cell gives off an axon that winds its way up to carotid arteries, external and internal carotid arteries to get to the targets. Questions? Simple, right? Well, if you get this down, I mean, this is something you're going to get hit with again in medical school big time, so you should help prepare you for that. And this just shows a summary of those things here, so you can read through that, and that might help you to organize those different, 4 different scenarios. So there's really 4 different scenarios here. So that's it for the sympathetic system. Any questions on that? That's it for the anatomy, anyway, of the sympathetic system.
Yeah, I have a question. So, what are the collaterals? The collateral ganglia?
So the collateral ganglia are, this slide here shows an example of the collateral ganglia. So they're
Oh, that's the celiac. That's where the splanchnic nerves
Yeah, right. So they're up, they're on the aorta.
Okay.
Yeah. So the splanchnic nerve comes over and synapses in the collateral ganglia, and then the postganglionic fiber goes out to blood vessels to get to the target. Liver, kidneys, guts, whatever. And there's some major ones. You have celiac, superior mesenteric. This is the superior mesenteric artery, and this is the inferior mesenteric artery here. So you've got three major ones, and then there's some other minor ones. Then there's also some other ganglia that give off fibers that go down into the pelvis and innervate some pelvic viscera. So, you have these three major splanchnic nerves: greater, lesser, and least. Then there's also lumbar splanchnic nerves that come off the chain ganglia that are in the lumbar region. And then down in the pelvis, there's some chain ganglia down in the pelvis too, and those give off splanchnic nerves also, but those are called sacral splanchnic nerves. So you have thoracic splanchnic nerves, lumbar splanchnic nerves, and sacral splanchnic nerves coming off in the three different regions: thorax, abdomen, and pelvis. If it's not on this slide, though, I'm not going to ask you a question about it. Okay, anything else? Maybe when you have a chance to look at it a little more, you'll have some more questions, so you can email me or whatever you want to do. Come by the office. So this shows the parasympathetic nervous system. It's got a completely different anatomy. It's craniosacral. So the major nerve, as far as abdomen is concerned, most of the innervation of the abdomen is achieved via the vagus nerve, cranial nerve 10. Also the glossopharyngeal nerve and the facial nerve and the what other nerve? Oculomotor nerve also carry parasympathetic innervation. But all that parasympathetic innervation targets things in the head, whereas the abdomen receives a lot of parasympathetic innervation from the vagus nerve. It passes through, it runs along the esophagus for a while, kind of spreads out, forms a plexus on the esophagus, and then when it gets to the diaphragm, it forms up again into some major trunks, and then follows blood vessels out to its target. Just like the sympathetic fibers, but they're all in this case, all those fibers in the vagus are pre-ganglionic fibers. And the terminal ganglia, they're called for the sympathetic nervous system, parasympathetic nervous system, they're called terminal ganglia. Those are mostly in the walls of various organs that are being targeted. Then another, so you have this cranial origin of parasympathetic fibers in the brainstem. And then another area is the sacral cord, S2, 3, and 4. Those sacral levels. There's parasympathetic cell bodies there, preganglionic fibers. And they pass out, those pass out from there in nerves called